Welcome to our channel Top Reddit Story. Make sure to subscribe our channel and leave a comment down below saying I subscribed, and we will try our hardest to reply your comment. Doctors of Reddit, what's the most incorrect patient self-diagnosis you've seen? I had a teenager and her mom come in worried she had some kind of serious circulation problem because her toes were blue. I looked at her feet and thought that's not really the right shade for loss of blood flow. I grabbed an alcohol swab and proceeded to wipe the blue color off the tops of her toes. I think it was from her new jeans. As a paramedic, I responded to a dispatch for a sick person. When we arrived, this old guy was clearly having a stroke. He said I just ate some bad fish or something before taking a 3-hour nap. Luckily his wife finally decided to call 911. Pediatrician here. A lot of parents come in thinking their child has cancer because they won't eat anything. Actually, they just don't like vegetables and are eating themselves to obesity with the crap you substituted with. Not a doctor, but a psych first responder. Patient self-diagnosed as dead. EMTs didn't believe him. He was quite insistent though, and wanted an ambulance ride because he thought a dead person ought to have one. The EMTs argued with him, stating that he was both standing and talking. He countered that he was in hell. In fact, he was just pretty high with a bad drug combination. I had a fun hour with him while he came down. As a medic, I had a soldier run up to me and demand to see the PA. When I asked why, he said his girlfriend has BV and now he's sure he does too. I assured him that he most certainly did not have bacterial vaginosis. Edit: to add a note, the soldier in question was symptom free. And we definitely still let the soldier see his provider. Elderly man with dementia brought in for suspicion of toxic epidermal necrolysis, a serious and life-threatening reaction where your skin peels off in sheets. Nope. It was a very large burn because they left grandpa alone at the house and he spilled a teapot on himself, and the family, and another hospital, were too dumb to figure it out. I would say after a couple years working in an emergency room before and during medical school that by far the most common egregious self-misdiagnoses involve pregnancy. Tons of sexually active patients coming in complaining of morning sickness and gaining weight. And just sure they have some sort of GI issue or infectious disease. When it comes around to asking questions, oh yeah, come to think about it, I haven't had my period in 3, 4, 5 months. That's not to mention the people coming in fully in labor and delivering in the ED. Truly shocked that they were pregnant at all. Now I understand people can have irregular periods and there are many cases where the patient is reasonable in not guessing what's going on. But there is a large group of patients who missed a lot of obvious hints. Denial ain't just a river in Egypt, I guess. And I do have empathy for patients in situations where they really don't want to be pregnant and so perhaps are subconsciously blocking it out of their mind. But a medical mystery it is not. Man who rode his bike, a sole method of transportation, came in for chronic knee and leg pain. He had metastatic prostate cancer with bone lesions all over. Came in for my legs hurt. Left with hospice referral. Something similar happened with my father. His lung tumor pressed on a nerve, which manifested as shoulder pain he thought he got from playing so much tennis. Was first treated for pain only. Took some weeks until he received the diagnosis. Dead 12 weeks later. I was in my work placement years when this happened. A man in his early 20s has committed a crime and claimed that he won't be going to jail because he self-diagnosed himself with personality disorder from Google search. Police officers brought him in for my mentor to diagnose him. My mentor exact word: "You do not suffer from personality disorder. You're just an asshole." I am waiting for the day I could use the same line as my now retired mentor. Edit: my mentor did not diagnose him, by the way. He knew the guy was faking it and all the police needed was a confirmation from a medical professional. When I was 15, my mother was absolutely convinced that I had mono as I was coming home from school and sleeping for several hours. Eating dinner then going back to sleep. So, she took me to the doctor who did an evaluation. It turns out that I didn't have mono, I was just lazy. Side note, This period of laziness was only a few weeks after the conclusion of varsity swim season. So I was naturally exhausted from months of training. I once thought I had a perforated colon because my poop was bright red. I spent an hour on the toilet in pain googling symptoms, and then I remembered I got high the night before and crushed a bag of flaming hot Cheetos. I'm not a doctor, but I am a medical assistant. I did my preceptor at a kidney and hypertension center. Had a guy come in complaining of painful urination and thought he had a UTI. Gave him a cup and told him to pee and set it in the window. The lab took the cup and immediately brought him back to room. Which was strange. BC, this place stayed packed and it was all first come first serve kind of thing. Well, this guy went back. BC, there was blood in his urine. A lot of it. This guy was beyond 300 pounds BTW. Just massive and extremely tall. Doctors got him in the room and stayed for maybe 15 minutes before we had him transferred to the ER. Apparently, he had a fractured pen 15 and had no idea. The nurse above me said they lifted his gut and his entire groin was purple and black and his pen 15 was at a weird swollen angle. She said she'd never forget it for the rest of her life. The guy never did tell us what happened or anything. He acted just as surprised as everyone else. TLDR, UT turned out to be a broken dick. Not a doctor, but is somewhat related. This one night I started getting some excruciating cramps that were so bad I had to wake my mom. She asks me where the pain was and I pointed out the right side of my stomach, and instantly she tells me to get in the car and we go to the ER. She thought I had appendicitis. We get there. I'm hooked up to morphine and they get an x-ray. I didn't have appendicitis. I just had to shit real bad. No two people. A good friend and my sister's fiance. Who complained of backaches. Like they pulled a muscle. Pancreatic cancer. Went from pain to them passing away in less than 90 days. Edit. Thanks to everyone for their stories. All of them bring back both good and sad memories. To everyone else, if you have a pain that just doesn't feel right, go see a doc. We want you here. I'm not a doctor, but I am a medical professional at a hospital. Patient came in stating that he had blood in his stool for almost a year and was convinced that it was just because of hemorrhoids. He only came in when he started to get abdominal pains. Turned out to be colorectal cancer. Moral of the story is, if you have blood in your stool, especially dark colored, don't ignore it. I was rushed to the ER as a kid because I woke up and my face was blue. Obviously my parents thought I wasn't breathing. I'm 8 or 9 years old. And everyone's sudden change in demeanor is making me a little scared. And I'm just getting bluer. At Emerge, they're running all kinds of tests that aren't showing anything wrong with me. Until finally my dad realized that I put the brand new Toronto Maple Leafs pillowcase I just got on my pillow. Washcloth later. I was all better. Physician assistant that works in the emergency department here. Had a woman. Around 45 years old. Come in with her mother for a complaint of a spider bite to her back. It was actually an abscess. No big deal. That's pretty common. People think abscesses are spider bites all the time. I incised and drained it and sent her home on antibiotics. Pretty standard procedure. Told her to come back in 2 days for a recheck. When she came back it was looking better. She and her mother thought it was something serious because it still wasn't all the way gone yet. But it was healing well and there wasn't much to do. She and her mother came back again another 2 days later and told me it was definitely gangrene. I tried to reassure them, but they both kept arguing with me that I didn't know what I was talking about. It was obviously a healing abscess and was looking a lot better. Looked nothing like gangrene, which they had googled. Had to get 2 of my colleagues to come in the room to reassure them, but they still didn't believe us. Think they ended up going to another hospital. TLDR, woman came to the ER 3 times for an abscess she thought was gangrene. Mother brought in her 3rd child. Kid's listless. Pale. Muscle tone is poor. Mother claims kid has misses. So doing my checks asking about food and home environment. Mother tells, oh little kid is lactose intolerant so we only ask almond milk, run a panel. Not only is the poor little 2-year-old not lactose tolerant dumbass mother has been starving his poor brain of nutrients by feeding him only vegetables, but no protein or protein-based items like legumes. Kid is developmental delayed because she saw an internet article on it. Ended up calling CPS on the edge. And having all of her 3 children removed. Had a daughter with bulimia. It was horrifying. Still pisses me off when I think it about. I'm not a doctor. But when I went to see a physician a year back for my shaking problem, I have severely shaking hands. I was told that it was a short-term problem that would likely go away in my late 20s. I told him I was on medication. And he dismissed it as an unrelated issue. Recently, I went to a different doctor. He assessed my symptoms. Jolting limbs. Twitchy face. Shaking hands. Locking jaw. Etc. Turns out I have tardive dyskinesia. Which is a very rare side effect of one of the medications I was on. It is irreversible after age 25. If I had listened to the first doctor, I would have permanent brain damage as young as 25 years old. Edit. Fixed spelling. Obligatory, not a doctor. And it wasn't a self-diagnosis. My brother was acting really weird at my wedding. Behaving like a jerk and his hands were shaking. He was my best man, so that made for some awkward interactions. He's also bipolar. So we all thought he was just off his meds. Combined with a lack of sleep, it was a 10 AM wedding. And he was working nights at the time. 2 months later he was diagnosed with a brain tumor. Not a doctor, but I went to the hospital about 5 weeks ago with what I thought was testicular torsion. I got told it was orchitis and was prescribed antibiotics for a week and was told it would feel better within days. Pain got worse and so did the swelling. Turns out it was testicular torsion and was operated on and sent home without my left testicle because a doctor was so certain this was just an infection and didn't feel it was necessary for me to have the appropriate scans to double check, which I later get told that it should have been the first thing he should have done in the first place. So now I'm 20 years old with a missing testicle and about a week now from full recovery. Duck you doctor, sing you incompetent wagstin. Edit. For those wondering or assuming. I'm from the UK, not the US. Although suing does sound super American. Schizophrenic guy thought his lungs were rotting, but it was okay because he'd just get a new torso from NASA. He's not even American. I don't know why NASA would give him said non-existent torso. No a doctor but a pharmacy technician. Had a patient yesterday tell me they went to urgent care and the nurse diagnosed pink eye. The patient didn't feel right about that and went to the eye doctor. Eye doctor told her she had an ulcer on her eye and if it went untreated properly she would lose eyesight and possibly the eye. I know a girl who woke up one morning and felt pain in her abdomen. She thought she had gallstones and phoned the ambulance. Wind. She had trapped wind. I thought people only made these kind of mistakes in cartoons. I was actually the patient but had convinced myself I had ovarian cancer. At 25 it was highly unlikely. But since I'm on immunosuppressants that increase cancer risk and had hundreds of x-rays and CT scans, but load of radiation, to my abdominal area I was worried when I had all the symptoms. Turns out I was full of shit. Literally. Found out ovarian cancer symptoms are nearly identical to constipation. Extra water and fiber supplements cleared that up. Don't trust WebMD. It makes you look like an idiot. However, when you live in a hospital for years and are taught to freak out over every little thing, liver transplant recipient, it's a hard habit to break. Not a self-diagnosis. But I had been seeing various doctors for months with what they thought was post-viral syndrome or depression depending on how the doctor felt that day. Then after being out in the sun one day I developed a male rash and my husband decided it looked like something he had seen on a medical program called lupus. Doctors laughed me and him out of the consultation room for months. I was too young. Not the right race. No family history etc. etc. Turns out they decided eventually to order the right blood tests and I have lupus. I do love doctors. But realize now that often their guess is as good as mine. Not a doctor myself. My grandfather was a doctor and had a patient come to his office complaining of a slight headache. His receptionist told him to wait in the waiting room. They called his name but the guy never came up to the desk. He actually suffered a major brain hemorrhage, died waiting to be seen in the chair. Not a doctor. But I did this to myself once. I was in high school, walking to class when I got a sudden sharp pain in my foot. I was running late and didn't have time to deal with it right then. But I only really felt it while I was walking. It faded quickly when I was still. And even then it was minor enough that I figured it would go away on its own. After a couple of weeks of dealing with it, I mentioned it to my mom, who thought it might be gout. I was a really lazy kid, so it was a definite possibility. We go to the doctor and he does an x-ray and it turns out I broke one of the bones in the ball of my foot. In short, I broke my foot and tried to walk it off for 2 weeks. Not a diagnosis but a treatment. The patient was seeing me for knee pain and he was a chiropractor. The diagnosis was nothing serious, but during the history part of the evaluation I asked him what he has done to try to treat his knee pain. He said he had his business partner, also a chiropractor, reduce my medial femoral condyle. I tried to hide the look of bewilderment on my face. Let's just say that treatment was not successful. The medial femoral condyle is a part of your femur, not a joint. It's literally just an area of the largest bone in your body. Yes, one continuous bone. I still don't know how or what was done, and I don't think I'll ever figure it out. Not a doctor, but I am a nurse. I recently had a patient who claimed that he used to have diabetes, but Jesus cured him of it. His glucose was nearly 300 on admission and he was in the hospital for an amputation of a gangrenous toe that didn't heal because of said diabetes. I'll never forget the doctor's note that said patient had a history of diabetes but states Jesus healed him of that. But since his blood glucose was 289 on admission, we will treat him as if he were a diabetic. When my husband was 8 years old, he complained about having intense pains in his stomach and became so lethargic that he couldn't be woken up. His doctor said there was nothing wrong and that he had growing pains for 2 years. It turns out his gallbladder had stopped working and would only function correctly a few days out of the month. After the doctor refused him a referral to another doctor for a second opinion, his mom took him to the emergency room and within 15 minutes he was going into surgery to have his gallbladder removed. To top it off, they jam-packed him with so many pain meds that he became so constipated and he couldn't use the bathroom for 2 weeks. He complained about his stomach hurting again and the nurses never once asked him when his last BM was, claiming that they forgot. He had to receive an additional surgery later that week in which he had 15 pounds of fecal matter removed from him. Talk about a shitty time. Not a doctor, but we had older man come into my ER with about 6 family members who all said he had some food lodged in his throat from dinner. He was able to communicate non-verbally and was able to breathe but not talk. Every single family member swore they could see it in his throat. We did a quick dredge. Blood pressure was a little funky, but it usually is when patients first come in. Another nurse and I brought him back to room, and as soon as we got him into the room his oxygen levels started to slowly drop. The doctor hurried in and prepped a scope to look down his throat. His oxygen dropped more and his BP started going up. The doctor quickly yelled that there was nothing in his throat. Literally the second she yelled it out he went into cardiac arrest. He had been having a heart attack the whole time. We did CPR for about 50 minutes. Shocked him a couple times to get him in rhythm, but it was to no avail. He passed. Not a doctor, but worked in a medical office. This is probably the opposite of what you were looking for. But we had a patient come in because he was having back pain. He figured he lifted something wrong working on his truck and the pain was just not going away on its own like it normally would. Turns out he had spinal cancer. He died about 2 months later. Nephew of a nurse anesthetist who worked an emergency room in Portland for years. Of the many stories he has, this is my favorite. Gets a call to come to OB by a doctor. Old guy is sitting on the examination table and the doctor says, "Tell Lou what's wrong." Old guy explains he is having a heart attack, was sitting on a bar stool and boom. Terrible pain in my chest. He had walked to the hospital just a few blocks away. My uncle realizes the old guy is very drunk. Doctor motions for him to look at the old guy's back. There is the handle of a steak knife sticking out. The old guy is oblivious. Turns out some nemesis of the old guy saw him at the bar and stabbed him in the back. The pain he'd felt was the steak knife blade sticking in his sternum or between ribs etc. The nurses and doctors of Reddit, what is your they never taught this in school moment? A patient being treated for HIV purposefully tried exposing staff members to his fluids. That was a sobering experience. What the duck? Do you know the backstory behind this or the aftermath? It's actually fairly common. Sadly, cops and emergency responders have to deal with it too. There's entire protocols for it. Mental illness and desperation. Man. I think it gives people who do this a sense of control when they're spinning out. How to put a fake eye back in. A patient came in from a not so nice nursing home with a multitude of problems. One of which was a disgusting, draining fake eye that had to be removed for treatment. Upon discharge, we had to put it back in. Simple enough we thought. But we had no idea how and struggled to figure it out. I suppose that is why the nursing home staff never took it out to clean it. This was decades ago. Fake eye technology is probably much better today. This one was fun. Patient in ER gets a standard urine drug screen. Positive for ethanol, alcohol. Patient insists he does not drink alcohol. Test is repeated. Positive. Patient is very upset. He does not drink alcohol. Blood test is drawn. It's negative. We checked everything we could think of. Did we have the right urine? The right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis. High white blood cell count. And really high glucose. Elevated white cells means you need to look at it under the microscope because they probably have an infection. It's loaded with yeast. The man was diabetic. Obviously, and had high glucose, sugar, in his urine. Along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. When my mum was fresh out of nursing school in the 80s, she got a job at a hospital that had a high concentration of geriatric patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in. My mum and another nurse tried to put them back in so as not to horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely didn't prep her for that nightmare. Student nurse here. How to hide looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him while he was putting a patient's prolapse rectum back in. Awkward. When I was a med student, we had a patient with rectal prolapse and the charge nurse said only a doctor was allowed to push it back in. Something about this being a procedure with risk of perforation. Sure. Anyways. Cue the intern, resident, and myself googling how to push a prolapsed rectum in. My job that day was to find sugar packets because apparently if you can't just push it in, you sprinkle it with sugar and try again. Not something they taught us during the preclinical years, and obviously the intern and resident hadn't learned it in med school either. Nearing completion of an air contrast barium enema on an extremely elderly patient. Out of nowhere she starts saying call Rochester Funeral Home. I'm dead, call Rochester Funeral Home, I'm dead, she repeated it no less than 10 times. When I was a student I accidentally degloved a patient from the elbow down. They were incredibly sick. Probably already brain dead. And had one of the worst case of 10 toxic epidermal necrolysis I've ever seen. Anyway, I'm in there holding this lady's inside out arm skinned like an idiot. With the family standing in the corner horrified. And I just froze. My first thought was to kind of slide it back on. But thankfully one of the senior nurses rescued me and snipped that sheet off. The first time I had to tell someone their loved one didn't make it. No one really tells you how to break bad news to someone. How shitty and impotent you'll feel doing it. The fact that you won't be able to answer their panicked questions. What it's like to realize that there's nothing you can say to family members that will truly bring comfort. How shocked or even angry you'll be when some people don't really care about mom going downhill. How ashamed you might feel when you look back and realize that you're becoming numb to it all after a while. Yeah. You probably had to click through some presentation on the 5 stages of grief at some point and maybe a generic lecture on what not to say. But until you've stumbled through it a few times, you're winging it. And probably poorly. Nurse here. A very panicked nursing assistant came running to the desk one day saying, "You have to come see this. I don't know what this is." The NA brought me into a patient's room where she was giving a bath and points to an area on the patient's buttocks. "What is that?" I lean in for a closer inspection. When the patient starts to turn back around and says, "Is that my eye?" Sure enough, I didn't receive a report that my patient had a prosthetic eye which at some point came out of the socket and became suction cupped to her buttock. I left the room and had never laughed so hard in my life. From former boss, how someone looks at you when he tests positive for HIV. After his wife died of AIDS. Because you were her doctor and you treated her for years. You were also his doctor. You knew she hadn't told him. And you knew that she was still having unprotected sex with him. Wow. So many things. I think one important thing that was never taught is how to deal with a patient dying for the first time. I couldn't stop picturing his last breaths. The yelling of his family. All of it played through over and over. Hospice is tough. But it still is one of my favorite jobs I've ever done. On behalf of my husband, no one tells you how many low-income women will go to the ER. Complain of abdominal pain. Go through an exam and have different tests ordered because they can't afford a home pregnancy test. EMT here. Sorry to intrude. They teach you how to handle death. They tell you, you're going to have dead patients. You're going to see the ugly side of death that doctors and nurses don't have to see. Because when they get the patient, most of the ugly is handled by you. So we need thick skin. But when you have to hold the hand of a kid less than 10 years old who says I don't want to die and next watch him slide into an waking up sleep. It's ducking life changing. Duck me. I didn't want to cry tonight. Enough Reddit for today. For my GF. Walking into a patient's house, home health, and almost being knocked unconscious by the smell of cat piss. The lady housed 25 feral cats but didn't let them outside because she was afraid the coyotes would eat them. Walked into a trailer house connected to a camper only to see the floor start moving. Realized it was cockroaches. Not the actual floor. They never really tell you how to cope with being berated by family members, patients, and even co-workers. Part of being a nurse means that you realize you are dealing with people at their most vulnerable. And you know this in the back of your head. But being an emotional, and sometimes physical, punching back for days at a time requires a certain mental toughness that you can never really prepare for. I heard this story from a SLP. Always keep a clear exit. She was working with a stroke survivor. Set her at the workspace. And walked around to the back of the table with her back against the wall. And facing the door. Suddenly the little lady says, "I know who you are. You're the lady who has been sleeping with my husband." Suddenly this lady has lunged across the table and is legitimately trying to kill the SLP. Luckily lots of other people came when she screamed code blue. She couldn't think of anything else at the moment. I was never taught about sundown syndrome until I was working with the elderly in a hospital setting as a student nurse. I had the sweetest elderly patient in my care until about 4 PM that day. He suddenly became possessed. He started screaming and hallucinating and was not the man I had been providing care for earlier. I was so befuddled when the nurse I was shadowing told me he had sundowners and explained it to me. RN here, for me. The most surprising thing has been seeing firsthand how peaceful it is for a patient to be able to choose when and how they will die. I was present for the first medical assisted suicide on my unit. The patient had his loved ones surrounding him and we all watched as he said goodbye and shortly after took his last breath. In my area of nursing, patients get better and go home. I always viewed my work as a means to make people better. It has taken me a while to process his decision. It was beautiful and peaceful and really made me look at nursing in a different way. I care for people to help them live. But for this man I was able to support him through death. Book world and real life nurse world is completely different. I'll play along. They never teach you that your psychotic dementia patients will try to hit you. They don't teach you how to react, or don't, to a patient or family member or physician yelling at you. Patients having sex and or shooting up in the bathrooms. People coming in OD'd and then bouncing out the door as soon as they are conscious to come in OD'd again a day or two later, then repeating the cycle every week or two but somehow never dying. Patients who fake symptoms to get admitted for attention or to get a day off work or get hopped up on goofballs or whatever thing they are after. Delirious old ladies telling me to get out of their living room or they will shoot me. Any kind of self-harm. Patients coming in next to dead because they've been neglected in the prison system. They never teach nurses how to manage expressions in unexpected or poor situations. I personally have no trouble hiding everything. But watching people around me and the patients, themselves tend to ask me what's wrong with that nurse doctor. Me being able to keep such a straight relaxed face and expression helps everyone around normally. Being able to explain something bad without a panicked expression is an invaluable skill. Which can definitely be taught. Though nothing can prepare you for some situations. I can say I can't remain relaxed when I see a high risk person self-remove a trash tube. Obligatory, not my story but my grandmother's. My grandmother was a school nurse at an elementary school. They were letting the kids out for the day and all of the kids were waiting outside for the day. One little boy's mom came to pick him up. As she was walking up to the building, she began to have a heart attack. My grandmother began CPR, sent someone to get the defibrillator, and told another teacher to call 911 as you were supposed to do. She passed before 911 arrived. I don't think twice her time in medical school could have prepared her for that. My mother was a nurse who cared for elderly patients in a very rural part of England. Here's a few her favorite stories. One was a lady who decided to help clean the windows. She used the food from her dinner as soap and napkins. There was a fun mess to clean up. Another was 3 gentlemen who spent the night calling out for their wives. One was named Edie. One was named Emma. The other was named Elspeth. She said that was one of the longest shifts ever. Finally, she said most of the elderly men were completely clueless when it came to ordering their dinners. They would always say something along the lines of "that's my wife's job." She used to just order them the basic meat and 2 veg option and rarely got complaints. Whatever your granddad would like usually was the safest bet. My grandfather was a farmer. As a sonographer, I have to keep a poker face a lot of times when I am seeing something very alarming or sad on the screen. Luckily, most people have no idea what I am looking at, so that's a plus. I'm not allowed to give any results to patients. Doctors deliver the bad news, so I have to stay neutral. It's really hard. When your patient has a sheet the size and shape of a football stuck in their butt, and you have to use your finger to delicately scoop it out. When the doctor comes along and tells your patient they are dying of cancer, then walks away and leaves you to pick up the pieces. When your patient is 90 years old, has dementia, diabetes, cancer and comes to hospital with pneumonia. They are 30 kilograms soaking wet. Nothing but a bag of bones who doesn't recognize themselves in the mirror. Yet their family insists they are for CPR. Had a 60-something-year-old female patient show up for a same-day appointment to establish care from out of state. No medical records. Denies any major medical history or medications. Never smoked, drank, or did drugs. Midway through the exam she starts telling me that she is seeing evil lines all over her house. States she is unable to cross these lines and thus unable to access parts of her house, for example, her bathroom. Hears voices coming through the walls. Feels shadows at night are demons. Thinks the neighbors are hexing her all the time. Starts talking about the occult and Freemasons ruling the world. Suddenly stops mid-sentence. Stares at me without blinking and wants to know if I could perform an exorcism. Oh. Sorry. Missed that section in medical school. Sexually harassed by an elderly patient. The guy is 80 and frail. Was I grossed out? Yes. Was I threatened? No. But they don't teach us how to respond to impotent harassment from hospitalized patients. Do I get a new doctor for him? Should I put up with it? I treat rude abusive assholes every day. Why would this be any different? Still trying to figure out what I should do. Vet tech in the past, there was this big bulldog whom we sedated to remove an oral mass. The dog was intubated and the cuff at the end of the tube was fully inflated. That said, the dog managed to somehow swallow part of the mass and started choking on it. Right away I took all 120 pounds of him and turned him upside down, shaking him all over the operating table, trying to make him regurgitate the mass. Eventually I succeeded but had a back pain for the rest of the day. Lesson learned. Gotta work on my core. Had a patient with horrendous teeth, meth user. Couple of teeth fell out during intubation. So they sent him up with them in a denture cup. That was a real awkward conversation when he woke up. Anytime there's something up the butt. That time 100-year-old grandma broke her hip falling out of bed, but not her bed. On a more serious note, the "your loved one is dead" phone calls. This is usually done by the doctors, as I feel it should be. But sometimes nurses do it. As a nurse's aide we are just supposed to say "I'll get the nurse for you" when you get a real stumper. But when a dying patient or their family member cries to you they don't want to die, you can't get someone else to help them. You have to find the exact words to find in the middle of serving dinner and 5 call bells ringing off your hip. Probably the hardest situation in palliative work. What to do if a gang member comes into your ward and shoots your patient who is a rival gang member? That was a nightmare. 4 shots at point blank range and even then one of the bullets hit the overbed table instead. It freaked me out that you could still hear the bullet rattling around inside it whenever you moved it. I quit nursing soon after and went into it instead. One of my co-workers' patients was altered mentally and got physically abusive frequently. Like whenever the call bell went off everyone went running. Well, the alarm rang and I ran into the room and tried to get in between my co-worker and the patient who was hitting her repeatedly. When I approached he reached into his diaper and slammed a handful of poop onto my head and face. You don't learn how to deal with mental warfare in nursing school. Paramedic here. They don't give you a class on telling families bad news such as in the death of a loved one. I found over the years if you come out and say so and so is dead, literally using the word dead, people understand it better. It's brutally honest and not beating around the bush. I don't use passed on or in a better place. I'm not a religious person or even remotely spiritual, so I don't say religious crap. It's not place to do that, I just give them the facts. As a student nurse I observed a cesarean DT preeclampsia. Lady is awake with epidural in place and a screen in front of her. All went well. Nothing dramatic there. Uterus sewn back up and I was starting to relax and look around when the surgeon asked the med student at the foot of the bed to step aside. He then reached in and pumped the uterus twice and hard, forcing the remaining after products out her vag fast. The wall wasn't that far from the foot of the bed and that student had definitely been in the line of fire. The PT didn't notice and the husband didn't seem to. The med student and I looked at each other. She just said, "I guess that's logical enough." Dunno how standard that is.